Other people I want to call on. How about Charlie Rand? He has a tax committee that's important.
People have said that when I first came to Washington, George Washington had black hair. I have to tell you, Mr. President, this is one of the most exciting experiences and opportunities. There hasn't been a year that we haven't talked about this. And you have brought all of these different stakeholders to read from the same page to show how important it is to our country. And I'm excited about it. Our speaker has made it abundantly clear that maybe a lot of people enjoy it, but it won't be a community, it won't be those of us who have jurisdictions. There's nothing that we would rather do than be able to say that we help for you to fulfill not just a campaign obligation, but a moral obligation we all have met. So, Senator Kennedy, this is a fantastic day. There hasn't been a time we haven't hoped that we can do this. And so we know that there's going to be a lot of problems. But we also know what you've created is a group of missionaries to make our political job easier so that when we have the problems, they won't have to say, what are they doing in Congress? They can go to our union leaders, our business people, our advocate for children, those that do want public program, and at least we would know that we're moving in the direction which our country wants us to do collectively. So I'm proud to be on the team.
Good, thank you. Is your counterpart on your committee here?
Yes, he is. They
Come on, David.
work so closely together. If we can keep the disagreements down, we'll be a hell of a team.
Well, what I meant, Charlie, was let's give him the mic.
Microphone, then you're not majority. But thank you, Mr. President. Thank you so much for bringing this all together. I think much of what has been said I can agree with, and I think particularly the idea that we have an American solution. And certainly in America, the idea that a patient and physician make the healthcare decisions that affect them is certainly something we need to protect. And I just appreciate the opportunity to be here. Look forward to working with you. There's so many things that we talked about we had in common in terms of health information, technology, wellness. But we are going to have to figure out just how much of our economy is devoted to healthcare. And that's going to be a big issue we have to face. And there's cost shifting that goes on between public and private healthcare dimensions. And those are challenging things I look forward to working with you and your team on this.
Well, you raised a couple of important points. Number one, doctors. And I'm assuming that we've got somebody, and I'm going to call on them in a second, but I've got a lot of very close friends who are doctors. And the enormous pressure and strain that the medical profession is now feeling from a whole variety of sources is something that we've got to attend to in this reform process. We're not producing enough primary care physicians because the cost of medical education is so high that people feel that they've got to specialize. The issue of malpractice insurance is real, and if you're an OB-GYN, that is enormous pressure that you're having to deal with. One of the things that we've done in this budget that we're presenting is to finally surface what had been the fiction that we weren't going to give doctors higher reimbursements. We always did it in the end, we just didn't budget for it, and it caused enormous stress for them. Now, the flip side of it is if we're going to do more for doctors, part of what we've also got to say is if there are states like Minnesota that are providing as good or better care than other states and yet are keeping their costs lower, and Medicare and Medicaid reimbursements are better controlled, shouldn't we be learning from what those states are doing and then making that more generally applicable? And there may be some resistance on the part of providers to say, well, our circumstances are different in this state or that state, But this is what I mean when I say that data and evidence have to drive the process. If we can find better practices, then doctors have to be willing to learn from the experience of others in terms of controlling costs. They've got to be part of the solution as well. So since I'm talking about doctors, we've got Ted Epperly of the American Academy of Family Physicians. Is Ted around here somewhere? There we go. Yeah, right there.
Well, first, Mr. President, what an honor to be here and to be with all of you. Speaking on behalf of over 100,000 family doctors, we're ready to do our part. We very much believe that we need to expand coverage in this country to everyone, and we need to fix the workforce, sir, so that all those patients have a place to go. We'll roll up our shirt sleeves and do everything possible to make this work, because it is the right thing to do. And I applaud you in this body for doing this today, to do it this year, and you must do it. Thank you.
Okay, before we break up, because we've been using some time, and I'm starting to get Reggie Love signaling over there, whenever he stands. Since he's 6'5", I see him, and I don't. We're running out of time. Are there some people I did not call on that had a critical question or point that they would like to make?
Mr. President, thank you very much. I'm Lois Katz, and I will love to follow the doctor. I also want to say to Senator Kennedy, this is the time. As one of 3 nurses in the U.S. Congress, the proposals you are putting forward resonate. Nurses do provide quality care. They help reduce costs through increased preventive care, and they deliver cost-effective primary care along with physicians, especially in underserved areas. But we have a huge shortage of nurses today, and estimates are that the U.S. will be lacking over 500,000 nurses in the next 7 years. Our nursing schools are only able to vet a tiny fraction of applicants. The greatest bottleneck for educating more nurses comes from the lack of nursing school faculty. You've done a great job by proposing an increase in nursing education in your 2010 budget and by including nurse education funding in the Recovery Act. I'd love to hear your thoughts. If there's no time today, I'd love to pursue this. There are other nurses in the room on how we can further advance nursing education and faculty training, because they're going to be essential to our overall efforts to contain costs while expanding and improving care. Thank you very much.
Let me respond to this right away, because it's not that complicated. Nurses provide extraordinary care. I mean, they're the front lines of the healthcare system. And they don't get paid very well. Their working conditions aren't as good as they should be. And when it comes to nurse faculty, they get paid even worse than active nurses. So what happens is that it is very difficult for a nurse practitioner to go into teaching because they're losing money. The notion that we would have to import nurses makes absolutely no sense. And for people who get fired up about the immigration debate and yet don't notice that we could be training nurses right here in the United States, and there are a lot of people who would love to be in that helping profession, and yet we just aren't providing the resources to get them trained. That's something that we've got to fix. That should be a no-brainer. That should be a bipartisan no-brainer to make sure that we've got the best possible.
Thank you, Mr. President. I know you stressed the cost efficiencies, and that is certainly important, and it was an important part of our breakout session. But I also want to commend you for also being honest and saying that there has to be a new source of funding as well, because in your reserve fund you mentioned a new source of funding dealing with deductions, whatever, for people over a certain income. And I do notice that there is a tendency to think that we can somehow expand health insurance and achieve coverage for everyone just with the existing money in the system. And I don't think that's true. So I want to commend you for that, and I want everyone to keep in mind the fact that we have to come up with a new source of funding, either what you proposed or perhaps others, because even as you said in your budget message, that this only pays this reserve fund for about half the cost if we're going to cover everyone. And that's an important part of this as well.
Well, I want to make an important distinction, though, between short-term costs and long-term costs. I don't think that we can expand coverage on the front end without some money. By definition, we will not have changed the system sufficiently to drive down costs in order to pay for new people being part of the system. Now, keep in mind, we're already paying for those folks. Every single person at home, the average family is paying $900 per family in additional premiums because of the care that people are receiving in emergency rooms. So we're paying for it, but it's oftentimes hidden. But capturing those savings will take some time. Health IT is going to save money, but it's not going to save money in year 1 or year 2. It'll save money in year 10, 11, 15, and 20. If we're doing a good job on prevention and are reducing rates of obesity. If we went back to the obesity rates that existed back in 1980, we'd save the system $1 trillion, but we're not going to do that overnight. It's going to take some time. So what we constantly have to think about is short-term costs versus even higher long-term costs. And the single hardest thing to do in politics, and that's part of the reason why healthcare reform has consistently broken down. In year 50, and making sure that our children are not bankrupted. Now that creates a very difficult political task. Nothing is harder in politics than doing something now that costs money in order to gain benefits 20 years from now. It's the single hardest thing to do in politics, and that's part of the reason why healthcare reform has consistently broken down. There should be enough money in the system. We spend more per capita than any nation on earth. And to find that American solution that mixes public and private, but also says we shouldn't have such an inefficient system and we should make investments today to ensure that we're saving money down the road, that's going to be our challenge.